breasts are the largest I have ever encountered.
Beverly Hills plastic surgeon Dr. John Anastasatos specializes in breast augmentation and has seen firsthand the miraculous change surgery can offer.
I have back pain and my neck. It hurts a lot.
These symptoms will go away completely.
Life surgery demands serious thought.
I'm going to make my incisions where those markings are. We're going to lift them up, make them nice and perky. The operation is going to take about 3-4 hours.
I feel like I'm gonna be born again.
It's certainly the largest breast reduction I have ever done. Let's take a look, okay?
A 34-year-old woman with breasts that were ruining her life.
Do you think your breasts weigh 100 pounds?
I don't know.
Massive, uncomfortable, and causing pain for nearly 20 years.
I felt a lot of pain on my shoulders and my back.
Atop Beverly Hills plastic surgeon Dr. John Anastasatos knew he was facing perhaps his biggest challenge.
What do you think that this surgery will help you do?
Start, running and exercising.
Now for the amazing results.
So you remember before your surgery, your breasts were almost down to your pubic bone. They were very long. You were probably a triple D to a knee when we started, and now you're down to a C.
Wow, they look so beautiful. Thank you, doctor. I really like them. They're so beautiful. Even my kids, they'll tell me, Mom, you lost a lot of weight. Yeah.
Reduced by several cup sizes, the difference is dramatic.
They look perfect. I didn't expect that, actually. Yeah, they were so perfect.
Beverly Hills plastic surgeon John Anastasatos.
Patients should ask their doctor where he trained, by who he trained, how many years of training did he have? Was it formal training? Is the doctor a board-certified physician in his field?
A good plastic surgeon wants to know everything about your health before operating on you.
The pre-operative workup is of paramount significance. And beyond any laboratory results that we may order and get, that discussion where one sits and tries to find out all of these medical conditions is what matters the most.
Personally, I would like to look the best that I can. I've always been a person that was fairly attractive, and academics were very important to me, but I always wanted to look my best. I think it's important to look your best. And so I would like to maintain the way I look as long as I can.
Hi.
Hey,
how are you?
I'm fine. How are you?
Good to see you.
You too.
When I first met Dr. Anastasatos in 2006, I gave him my laundry list of procedures that I wanted to have performed.
She had reached a point that she wanted to do some things for herself after working so hard taking care of her family and her children. Her main concern at the time was what we can do to improve on the looks of her abdomen and her overall torso.
We decided that I would begin with an abdominoplasty and liposuction. The results exceeded my expectations in that I had no idea that my stomach was going to be so tight. It was going to be tighter than it was when I was 20 years old, which I thought was amazing.
Since then, Allison has had many other procedures. We did the modern abdominoplasty, where I combined a lot of liposuction, and that gives a very, very nice definition of the whole contour of the body.
I was ecstatic. I couldn't believe how I was able to fit into clothes that I hadn't been able to wear in years.
At that operation, Allison had the breast augmentation. Also at the time, she asked me to take some more of her own fat and put it in her lips.
I was amazed at how much that improved my face.
Allison returned in April, and at the time we did some liposuction of her hips. And I also used some of the fat to put it in between the eyes to make that area be nice and smooth. And then since then, we've done a little bit of Botox, some Restylane treatments for the face. And last but not least, we did an earlobe repair. So tell me, are you excited about your new procedure?
I'm very excited. I can't wait.
We're gonna dress her face next. These lines here, they represent a muscle that has been separated over time, and we need to bring it together.
Okay. I'm excited about my facelift. In the back of my mind was always the surgery I wanted first, but I knew that I needed to wait a little longer so that I would be able to experience the maximum results. So I'm thrilled that I'm finally getting a facelift.
You're starting to develop a little bit of what we call jolts. Can you see that over here?
Yes, I see it.
Allison is a great candidate for all of these procedures. For one, she's very healthy. That is of paramount importance. Secondly, Allison knows very well what she wants, and she has very realistic expectations. So that makes her a very good candidate.
Expectations are key when doctors evaluate potential patients.
Now look what happens, when I try to elevate that. This goes away, and your lower lids also get much improved.
Oh, wow, they do. I think it's perfectly healthy. If you want to do anything to make you feel better about yourself, I tell my children that it's the same as wearing makeup or coloring your hair.
Hello. Good morning.
Today, Allison goes in for her facelift.
Are you ready?
I'm very ready.
Open.
The operation is going to take about 5 hours. We're going to start with the forehead and proceed the eyes, the face, the neck, and finally the lips and the ears. Knife. So what we're doing now is we're separating through the main muscle that causes wrinkles in the forehead. This is the frontal muscle. So we're going to gently separate. We're going to lift everything up. You can see where I'm pressing. These muscles typically cause the frowning. I'm going to attenuate them a little bit so that they no longer can cause that. We have completed the forehead lift. We also raised the corner and the top of the nose. By elevating the mid-face, we will create nice cheekbones for her after I finish with the reconstruction of the tissues underneath. This is a very rewarding operation for the patient. This is not just an improvement of the flesh, but it has a profound effect on how people feel. And that's one of the most impressive things I see in my patients. The psychological effect and how much it boosts their confidence and their sense of self-image is tremendous.